In terms of rationale, radical prostatectomy, as we know, is the mainstay of surgical treatment for localized prostate cancer. However, there is currently no accepted or widely adopted method for intraoperative assessment of surgical margins in radical prostatectomy. The NeuroSafe technique has been well established in some high volume centers, but unfortunately it's not feasible to transfer into smaller, less high volume centers due to cost, and the requirement for high cost equipment and an on-call pathologist. Fluorescence confocal microscopy is a novel technique to provide rapid histological-like images intraoperatively. With confocal microscopy, the prostate is removed from the abdomen and dipped in a fluorescent dye for about 10 seconds and then placed directly onto what we call the histolog scanner, which can be moved in and out of theatre or in a nearby office. And within a minute, will give a microscopic image of the surface of the prostate. Currently, there's no prospective blinded evidence for confocal microscopy. So we performed the IP8-FLUORESCE study, which was a multicenter prospective ex vivo and blinded paired cohort study, including about 160 patients. All men underwent radical prostatectomy for localized or locally advanced cancers, and immediately afterwards, the prostate was scanned. The whole surface of the prostate was scanned for each patient, and then sent for standard of care histopathological assessment. And we compared histopathology, which is the gold standard for margin assessment, to confocal microscopy in 160 patients. So, as I said, 160 patients were included. 4 were excluded due to having variant or non-adenocarcinoma of the prostate, and 2 due to technical error. So that left us with 156 patients. The study was powered for sensitivity based on previous unblinded cohort studies, aiming for about 85% sensitivity. The target was 140 patients, and we managed to out-recruit that number. In terms of the primary outcome, the sensitivity for any length of surgical margin was quite low, and that was about 48%. However, looking at what we called significant margins, so margins that were 3 millimeters or greater, we found a sensitivity of 80%. In terms of the other performance characteristics, the specificity of the technique was very high. It was over 90% for both any margin and for significant margins. So in summary, the technology was not so good at assessing margins of all lengths, but for significant margins that are 3 millimeters or greater, had a high sensitivity.